The third edition of the Pan-African Surgical Health Forum officially began today under the theme From National Healthcare Policy to Practice, Expanding Africa's Multidisciplinary Surgical Workforce. The three-day forum brings together ministers of health, surgical and anesthesia providers, allied health professionals, researchers, donors, and civil society from across the continent. How to transform ambitious policy frameworks into practice, implementable surgical workforce strategies. In her opening remarks, Ethiopia's Minister of Health, Dr. Mekdes Daba, highlighted the urgency of translating health policies into action. She emphasized that the time for discussion has passed and that Africa must now move decisively towards implementation.
Nearly 93% of our people in the sub-Saharan side cannot access surgery when they need it. It is about ensuring access. And access does not come just by discussing in a room like this, where resolutions can be out, and we can say the Addis resolution, X and Y and Z resolution, but they can only be achieved when we sit together, plan, execute, and continue to ensure that they are on the table, and we discuss and check if they are delivered or not. We have community which is still needing access. So for Ethiopia, we are ensuring, and this is going to be a call for action for the continent also.
Dr. Mekdes also stated that Ethiopia is taking concrete steps to strengthen collaboration, calling up of all African partners to join and accelerating action for a healthier continent.
Ethiopia definitely stands with the call for action that will come out from here on innovation, to lead in solidarity, bringing the Africa agenda, the Africa 2063 agenda, because together we can definitely build Africa where safe surgery is not a privilege but a right. A continent where every mother is safe, where every child can come very safely to this continent. Every citizen can have an access for a very safe life-saving surgery, restoring dignity and fulfilling the promises that everyone have in front of them.
For his part, Professor Ababa, head of PASHeF, said the event aims to identify and implement key priorities for Africa's surgical healthcare sectors, focusing on expanding access to life-saving services, improving timely healthcare delivery, and fostering collaboration among African health industries.
We hope to host about 43 countries this time, mainly represented by high delegates from the ministries of health. We have about 4 ministers amongst us, about 5 state ministers, deputy ministers, and high-ranking officials of the different ministries. The very first step in finding a solution to a problem is identifying the problem. We're trying to create an avenue for these countries to identify their shared problems. There are several issues many of these countries share in terms of number of people trained, the quality of people trained, the maldistribution of trained workforce across the countries.
Mentioning the discussion will also emphasize the need for comprehensive plans to strengthen surgical capacity and workforce development across the continent. Professor Ababa emphasized that the participant countries is increasing time to time.
Since we started PASHeF in 2023, the participant countries increased from just 33 to 44, 45 now. Hopefully next year, 46, 47. The plan is ultimately all African countries should be part of it. When we started PASHeF, only 7 countries had what we used to call the National Surgical Anesthesia Plans, NSOPs. Basically, 45 countries had no plan around surgical care. Over the past 2 years, 11 additional countries have worked on their plans, and PASHeF supported it. The technical expertise amongst us helped these individual countries develop their plans. This will continue until all African countries are supported technically and develop national surgical anesthesia plans and integrate them to their national health systems.
The forum will continue over the next 2 days with technical sessions, policy discussions, and experience sharing workshops focusing on workforce expansion, financial mechanism, and innovation models for scaling up surgical healthcare across the continent.